Celebrating Hispanic Heritage Month at this time is an act of resistance to people who want to tell us that we don't belong here or that we value less than other people. I want to remind everyone that we have a long history of making this country better and making this country stronger, and we can use that strength to continue to make our communities healthier. I come from a Cuban and Dominican background. I grew up in the United States in Miami, Florida, so culturally I feel American. Different parts of my heritage come out through different aspects of my life. When I speak Spanish, I have more of a Cuban accent. I come from a Dominican background, which I identify with a lot because I've done clinical work in the Dominican Republic. My Dominican and Cuban ancestry has ancestors that came from Senegal in Africa. I do some health system strategy work across Senegal where my ancestors were taken from during the transatlantic slave trade. Medicine is a unique career path. It's a really good opportunity for me to improve the health of different populations, particularly immigrant populations, Caribbean populations, Latinx populations. What I love about the emergency department is being able to work with my nursing colleagues, my technician colleagues, to make sure that a patient is healthy, that they can leave the hospital and continue to care for their own health. I'm one of the first doctors in my family and the first to focus on emergency medicine and health equity. It was an incredible sense of accomplishment, but with that accomplishment comes responsibility to give back to the communities that help make me who I am today. Here at SUNY Downstate, I serve as Director of Innovation and Health Equity, where most of my job is thinking about how do we make care better for patients by understanding, focusing, and addressing their social needs so that we can set them up for success once they leave the emergency department. I played a lot of baseball growing up. It was a major part of my upbringing culturally, both on the Cuban side and the Dominican side. It's where I developed a lot of the hand-eye coordination that I use every day in the emergency department. It was a nice place to learn about teamwork, which I also do a lot of in the emergency department. I have the good fortune of living near Prospect Park, which is nearby here to the hospital. I like going out in Prospect Park, walking around, doing my exercise that way. Sometimes I'll take a jog in Prospect Park, but it's really nice being surrounded by trees, being surrounded by the community who's enjoying themselves in the park.